At this point, I want to introduce Professor Merin, who is in Israel, of course. And are you there? She's going to give us a brief update on what's going on. There we are. Good morning. For you, good afternoon, I guess.
Yeah.
Welcome. Nice to see you.
Nice to see all the people from Toronto. I'll be much happier not to see you in your houses. Here to see some of the nature in Canada, and in Toronto as well. But unfortunately, in Canada and here, remotely see our houses in our working place, and that's it. I'm sorry for the delay and everything. I'm in a double booking that was not expected, but there is a discussion in the cabinet of Israel now that they want to make a decision today. What is the plan for the holidays? If there's going to be a shutdown and everyone is going to be locked in their houses like we had in Pesach, or it's going to be somewhere in the middle and let maybe people gather in capsules of 10 people. So there's a discussion now, and I was asked to speak in the cabinet now, so I'm somewhere in between, and asked to speak there soon. Sorry for just 1 second. 9:15 מה? ב-9 זה? אבל יכול להיות שהצריך רק לראות עם ודים ש-9:00. בסדר, מקסימום נחרש מוקצת. Sorry, as I said, crazy days. So I'm trying to juggle between different positions now. So an overview of what's going on in Israel, and then a short overview of what's going on in Sharet Zedek. And Lisa, I would ask you to excuse me because I would not have the time now to go over a full presentation, but I will try to give an overview of what's going on. So in Israel, Israel was handling, I would cautiously say, quite well what we call now the first wave, meaning March and April. The numbers picked up and dropped rather quickly as there was a shutdown to almost everything in Israel. Implications of shutdown is known all over the world, both the social economic issues that happens in a shutdown. So you can shut down probably a country for a month or a bit more, but not for many months. Once Israel was reopened, as is expected, especially for the population of Israel, once you say, okay, you can go out, and everyone say, okay, there's no disease anymore, and everyone went back to the streets and people went back to their homes and so to the working place and, whatever activities they were going on. We started to see the numbers picking up during June, but then July and August, we are seeing a really high wave of numbers. And at least in the last 2 weeks, the numbers in Israel has picked from about 1,000 new patients per day to 2,000 to 3,000. And yesterday we reached almost to 4,000 patients. So number of positive patients to population in Israel now, unfortunately, is one of the highest in the world. And this is catching a medical system that, from one hand, is a good medical system. As I guess all of you, most of you know, I was working for 2 years in Sunnybrook in Toronto. So nothing to say wrong about the system in Canada, but I can say that overall, the medical system in Israel is in very high standards, like the one that we have in Toronto these days. So the medical system is good, but the number of beds for population in Israel is low, meaning that if you put on the medical system that is already overpacked in winters, if you put on it the corona patient, the COVID-19 patients, then we do have a problem. In the first wave in Israel, Sharet Zedek was the #1 hospital in Israel treating COVID patients. This was secondary to some of them are obvious reasons. Some of you I should probably share with you. The obvious reasons is that the 2 places that had the maximum number of patients was Jerusalem, and the other one was Bnei Brak. These were the two areas where we could see the disease spreading quicker and faster than other places. The other reason is the popularity and the trust of the people of Jerusalem, specifically in Shaare Tzedek. We had, and I'm not sitting here to try to compare to other places, but I think it's important to share with you, we had about 3 times more patients at that time than what Hadassah had. At that phase, for Shaare Tzedek, it was relatively easy to treat all of these patients. We were treating about 120 patients at every point of time. It was rather easy because of the shutdown and closure of everything. A lot of the elective patients we didn't treat. A lot of people, we saw less even urgent matters because people were not going out to the streets. So obviously much lesser accidents, people didn't fall, and people didn't catch contagious diseases not related to COVID. So Shaare Tzedek was able very quickly to transform regular departments to departments that were treating COVID patients. Once everything was reopened, the numbers started to pick up not related to COVID. Shaare Tzedek was again full. This is the status where we're standing today. Today in Shaare Tzedek, we do not have a single bed for COVID patients. This is from the different issues that I have to struggle and face with. This is probably the number one. We are packed, we are full. You know probably what ECMO means, right? ECMO is like more or less, it's not a heart-lung machine, it's more a machine to assist the lungs. So COVID patients, most of them are not, you know, they're sick, but if I'm looking at the majority of them, they're not badly sick. When they're starting to get sicker and sicker, oxygen is needed. And if oxygen is not enough, then you put a tube in the throat. And if this is not enough, you put them in prone position, meaning you put them face down. Shaare Tzedek, at least at the first wave, was the first hospital to try to avoid intubating patients. We were really leading in Israel the concept not to intubate patients, to give them oxygen in different ways, to put them in prone position, to avoid intubation, because worldwide at the beginning, intubated patients, 90% of them died. That was the overall in the world, the number of patients that were already with a tube that died. It dropped down worldwide to about 50%. In Shaare Tzedek, we were maybe 20%. So our results, if I may phrase it this way, were quite fine. But patients that are ventilated, and with the ventilator, you cannot support them enough, and their oxygen level is extremely low, and their life is in danger, you have to connect them to what is called ECMO. At this time, today, we have 4 patients on ECMO. This is a lot. I can say almost for sure that even in Toronto General and Sunnenberg, I'll be surprised if they have at a single point in time 4 patients on ECMO. So we're really playing probably one of the most, I don't want to say the number one, but there's no question that we are one of the leading hospitals to respond to COVID these days. So our struggle these days is for more space. This is the first struggle. And our plans now, as opposed to what we were doing in the first phase, is to try and get new areas of treatment. So the dining room of Shaare Tzedek, which in the last 6 months is closed, obviously people cannot sit and eat together. The dining room is transforming these days, and probably within a month, it's going to be a large ward of about 55 patients. And we're sitting these days with the government with plan to quickly build 3 more departments. So on the top of some of the roofs of Shaare Tzedek, we are planning to build 3 more floors very quickly, meaning within 2 or 3 months. We're seeking that the government will support them, and the government is willing to support, as we're speaking now, in Canadian dollars, where the Canadian dollar has dropped quite a bit as opposed to the shekel, but we are getting probably a bit more than 10 million Canadian dollars to support this new building. So we're trying to quickly build some new areas to treat COVID patients, and this has to be relatively quickly before the real winter starts. This is the first struggle. The second struggle is our staff members. When the COVID started, I said, we're going to get volunteers. And people were hesitating a bit if we'll be able to do it. My personal feeling was, yes, we will say we are not going to force anyone to work with COVID patients. I had personal experience in Toronto. I was in Toronto from 2001 to 2003. It was the SARS pandemic at that time. I must say that a lot of things that I learned in Toronto 17, 18 years ago from the SARS, I was able to bring to Sharet Tzedek these days. One of them was the huge concern for our staff members. There's, things that you remember 10, 20, even 50 years later is the burden on the staff members during the SARS. I guess some of you remember or can recall that in one of the hospitals in Toronto, a nurse that was treating one of the SARS patients got sick. She went home. She was contagious. Her husband got sick as well. And a week later, both of them died. So, it was really a crazy time for healthcare providers during that time. But even though my decision was that people will volunteer to work with COVID patients, and to make the long story short, all of the staff members working from the start of the corona during March this year till now, all of them are volunteers. We did not have to force anyone to work there. And another decision that I made, that we are not going to pay anyone. No one is going to get another single penny to work over there. So it's not you say, your life is in danger there. We're going to pay you more and it's worth it. So we said, this is a place that people are going to volunteer, and thank God people were volunteering over there to work, and it worked fine. But after 6 months of working with the corona, people are starting to be burned out, and this is hard work. I'm personally entering the department every week, just to go over and to be over there to see how the work is. To work with all these protective gowns is not easy. So the second real challenge is to keep our staff members. And the burnout and the workload is enormous. And again, it caught the medical system in Israel that we don't have enough healthcare providers over Israel. So this is the second challenge. The third one, and I must say this is probably a challenge that is quite unique to Sharet Tzedek, is the economical issues. Sharet Tzedek was able during the 118 years of Sharet Tzedek to be independent. We were able to keep our budget by our own. Sharet Tzedek is not able to do that anymore. The load of work, the number of patients that we are treating, the need to rebuild, we need a lot of support. So first of all, thank God we are getting quite a bit of support from the government. It's not enough yet, I must be honest. And this is really a daily struggle to get enough. And I'm personally putting a lot of efforts on this. These are daily efforts. The struggle with the Ministry of Finance, the Ministry of Health, and the government to get more and more budget for this. This is a major issue. And if I may speak here, we need your support as well. There's many more places that we are building very quickly. I do hope that the day after the corona, that no one knows when it's going to happen. And when people ask me, I'm saying, well, let's speak about the spring of 2021. It might be earlier. My personal feeling is that we will probably need to cope with it at least till spring of 2021. And I do hope that on that day, when either the vaccine are going to come, or we'll have a treatment, or it's going to somehow disappear. I do hope that we will find Shaarei Tzedek stronger because, we need to salute our staff members. As I said, people are volunteering and people are happy to come to work. In these times of challenges, some places, might take it to the wrong place, and, the burden of and the load of work on people can take it to the wrong place. Up to now, I am cautious with what I'm saying. We took it to the right place. People are proud to work here in Shaarei Tzedek. The spirit of the people during these 6 months is excellent. So I do hope that when the corona, we're going to speak it in past terms, I do hope that we're going to have a stronger spirit. We started with a good spirit already. I do hope that Shaarei Tzedek is going to be able to flourish because we're going to open and build new places. We're going to do that very quickly. And I do hope that it's going to assist our patients in the future. So we're busy recruiting new staff members that again will help us during these times now, but also in the future. That's what I had to say. I'm sorry that I'm a bit short, but I'm really somehow in the middle of other talks as well. I do want to wish you a happy new year. I do want to thank you for really the excellent support. And I think it's a good time maybe for all of us to try and get some more support because our patients need it now.